The NHS is beset by acute shortages of nurses and paramedics and is facing a skills drain, with staff quitting because of pressurised jobs and poor pay, health service chiefs have said. While the NHS in England has 40,000 more doctors than in 2012, it is short of 42,000 nurses, midwives and therapists, according to Health Education England, which has drafted the NHS's first strategy in 25 years to tackle chronic understaffing. The NHS's staffing agency, also warns that the health service workforce, which already stands at 1.4 million, will need to increase by 190,000 by 2027 unless the rise in illness recedes. He admits that the service's workforce has developed huge gaps in recent years in which the aging and growing population has created a greater need for care. It warns ministers that radical action is needed over the next decade to ensure the NHS has enough staff to cope with the growing burden of illness. Bank and agency personnel cover most of the vacant shifts, but he warns that patients could receive poorer care because unavailability of staff is so common that 8% of vacant shifts go unfilled, thus increasing pressure on existing staff and potentially impacting on quality. Shortages of this magnitude mean care for patients is suffering and staff are being stretched far too thinly. Unless something major happens quickly, more and more employees will quit, making a bad situation much worse, said Sarah Gorton, head of health at the union Unison. Shortages are now so acute that the NHS is short of 42,000 nurses, midwives, physiotherapists and occupational therapists. A widespread lack of nurses is most severe in London, where 15% of posts are vacant, and lowest at 8% in the North East. There are 1,674, 26%, fewer district nurses and 842 fewer learning disability nurses than in 2012. GP numbers have fallen by 1% over the last 5 years despite a key government pledge to increase the total by 5,000 between 2015 and 2020. Almost 1 in 3 paramedic jobs are vacant across England. The number of nurses leaving the profession rose from 7.1% in 2011 to 8.7% last year. NHS organisations welcomed the draft strategy as something trade association NHS providers called a sensible and constructive start to tackling the workforce problems. Professor Ian Cumming, his chairman, urged the NHS to become more family-friendly by offering more flexible working. The blueprint also argues that NHS staff will need to be trained differently to adjust to a new era in which less care is provided in hospitals and more in GP surgeries, clinics and patients' own homes. But some questioned his lack of detail on the future of recruitment from overseas, which the NHS has relied on to plug gaps since its creation in 1948, and on who will foot the bill for enacting the measures recommended to improve both retention and recruitment. The NHS does have more than 40,000 more clinical staff than in 2012, including more adult general nurses, A&E consultants, health visitors and community mental health nurses, he points out. But it has identified 4 key factors that are prompting increasing numbers of staff to quit, which it says is a major problem.